Hello, my name is Uzma Minhas. I'm a consultant gynecologist and part of the team here in NHS Lanarkshire. You've been referred to Colposcopy clinic for further investigation and treatment following an abnormal smear. Abnormal smear could be an early sign of precancer cells or cancer cells of the neck of the womb. The abnormality of the neck of the womb is mostly caused by HPV infection. HPV infection is asymptomatic, so most of the people would not know if they have it. In the colposcopy clinic, we will further investigate and determine if you require treatment. The treatment is usually simple, effective, and required only once. When you first come to the clinic, the team will welcome you to the department and take some details. We will have a short conversation about your smear results, your medical history, and explain what happens next. You will be asked to go to the changing area and remove your clothes below your waist. Your lower half will be covered at all times, and a member of our specialist nursing team will be there to support you. The examination is similar to a smear. It's an internal examination which involves insertion of a speculum into the vagina to have a closer look onto the neck of the womb. We use a special device called colposcope, which is a big microscope and allows us to determine where the abnormal cells could be coming from. We take a small biopsy from the abnormal area. Biopsy could be slightly uncomfortable, not very painful, and it's tolerated quite well by most of the patients. The biopsy is sent to the laboratory for a detailed checkup. The result will determine if you require a treatment or more regular smear tests. On some occasions, women can be offered treatment at their first visit in the colposcopy clinic. There are two possible treatments that can be offered to you in the clinic. They are both simple and effective and are designed to either remove the abnormal cells or burn them. Your doctor will determine which one is best for you. Before the treatment, you will be given local anesthesia around the neck of the womb. This will keep you comfortable throughout the treatment. Loop treatment is a quick heat-based treatment which involves removal of the abnormal cells and takes around 10 minutes. Cold coagulation is also a heat-based treatment which involves burning of the abnormal cells and takes around 2 minutes. Once your examination and treatment is complete, please feel free to ask any question you might have. Small number of women report feeling shaky after the appointment, so it is good to have someone to drive you home. You will experience small amount of bleeding or discharge for 5 to 7 days after the treatment. Use sanitary towels rather than tampons. This will reduce the risk of infection. If you experience heavy bleeding after the procedure, contact your GP or come to the emergency department. We advise not to have sex until this area has healed, which should take 2 to 3 weeks. We also advise that you have a follow-up cervical screening test 6 months after treatment. This is usually done at your GP practice. Thank you so much for watching this video and putting your trust in us. We look forward to seeing you at the colposcopy clinic at NHS Lanarkshire.